Well, the Dutch Women's Council, the Nederlandse Vrouwen Raad, is very pleased to present this parallel online event during the Commission of the Status of Women 2024. Our meeting is titled Stop the Gender-Based Violence, Address Women's Poverty and Dependence. We are proud to present 6 fantastic speakers and welcome the almost, 100 registered participants. My name is Levi Vogelpoel. I'm a representative for the Dutch Female Physicians Society at the Dutch Women's Council, together with Christine Everts, representative of the European Women's Lobby and Observatory on Violence Against Women and Girls, and Monique Beidek, both from the Dutch Women Council. We are your hosts for this meeting. Our chair, Astrid van Heumen, and our UN Women's representative, Hoba Gul, will be joining us too, and for them also a special welcome. And introduce our next speaker. So I'm very, very pleased to present to you Professor Dr. Anna Custers. She is a professor of poverty interventions at the Amsterdam University of Applied Sciences. With her research group, she focuses on questions of death and poverty in the Netherlands. Before joining the university, she worked for the World Bank as an economist. She completed her PhD in Oxford, and her presentation is called Poverty in an Affluent Country. Anna, can I give the floor to you?
Thank you very much, Levi. And good afternoon, good morning, everybody, depending on where you are in the world. It's an honor to be here with you today. Thank you very much for the invitation. Thank you. So I have some slides to support the story, but let's stay for a bit on the first slide, if that's okay. Yeah, thanks so much. So in the next 10 to 15 minutes, I will take you through the story of the Netherlands. We've already heard, some of the perspectives of the Netherlands just now, and I think what I will tell you more will further provide context to the story, for example, that Floor is very strongly painted for us. And so before I joined the Amsterdam University of Applied Sciences to focus on poverty in the Netherlands, I actually worked at the World Bank, also focusing on poverty, but then in very different context. And so when I moved to the Netherlands to work on poverty in my home country, many colleagues at the World Bank actually asked me the question, poverty in the Netherlands, does that even exist? What are you going to do there? And so this has actually been the driving force or question behind my work here back home, because poverty definitely does exist in the Netherlands. Poverty, of course, is different depending on the country where you are, but it has a common.
Oh, yeah, we have you again. Yeah.
Okay. Yeah, thank you.
You're there again.
So, okay. I don't know what you missed, but the key point is that poverty, of course, is different depending on in which country where you live. And what I will take you through is to focus on what it means to be poor in the Netherlands, a very rich country. So let's go on to the next slide. Thank you. So if we look at women and poverty in the Netherlands, then there is a couple of numbers that stand out. And this is all data from our Central Bureau of Statistics, which is important to note that these numbers that I'm presenting here are using a different poverty line than, for example, a single supermom just referred to. So internationally, when we compare poverty across countries, in particular in Europe, we use the median income in each country, and then the number of households that actually earn less than 60% of that median income. But we also have a different poverty line in the Netherlands, which is more of an absolute line. And in 2022, this meant that for a single parent with one child, you would earn less than 1,690 euros a month, and then you would be considered poor. Now, it's very important to keep in mind that this poverty line is the absolute minimum, and that is actually very difficult to get by on, and that many people who earn just a bit above that poverty line would still probably consider themselves poor, and there is a real lively debate at this moment in the Netherlands about whether the poverty line, as the Central Bureau of Statistics actually measures it, is the correct one. Anyway, when we use that poverty line that they have tracked for the last 40 years, we see that at the moment, female breadwinners are 1.5 times more likely to live in poverty compared to male breadwinners in the Netherlands. We also see that single mothers have one of the highest risks to live in poverty. 9% of single parents at this moment live below the poverty line in 2022. And we see that this is similarly high also for single households. So when you're single without children. And that sounds a bit counterintuitive, that actually the poverty risk for single households is slightly higher even than for single parents in the Netherlands. But there are clear reasons for that, which I will show in a minute. If we go to the next slide, please. Now, if we delve a little bit more into the data, we also see, and look at economic independence, we see that there are in the Netherlands that there are more than 20 neighborhoods where there is less than half of the women who live there who earn more than the poverty line. And this is about economic independence. So it's not necessarily that these women automatically live in households that can be considered poor, but this is more about financial independence. They can also be part of families where, for example, their partner actually earns the income, but they themselves do not make, they make money less than the poverty line, which of course influences your economic independence and your economic decisions that you can take for yourself. There are actually 5 municipalities in the Netherlands where less than 60% of women are economically independent. So that's quite astronomical, if you ask me. If we move on to the next slide, please. So what I mentioned earlier about the risk, the poverty risk for different types of households in the Netherlands, you can actually start to notice that policies do matter. We have too few of the right policies, but when the right policies are chosen, they actually make an impact. And what you see here is a graph of the poverty risk for single parents. And then that's in particular the dark blue line on top. And you see that until 2013, this poverty risk was actually sharply increasing. This was actually the fallout of the economic crisis in 2008, due to which many people lost their jobs, etc., and that then built on and reached a peak in poverty levels in 2013. But then in 2013, there was also an important policy that was implemented, and this was to increase the child benefits for working single parents. And so you see that from then onwards, the poverty risk for single parents declined quite significantly. So if we move on to the next slide, please, you can see that there are 2 points when this actually happened. So in 2013, this policy was implemented, and you see that at around 2018, you see that the poverty risk for single parents became a bit lower than for single households. So that actually explains the story, the figure that I just showed you. However, I do want to emphasize that this is all very much on paper. These are child benefits that parents receive in monetary form, but a very important additional aspect of the Dutch of free choice, in a sense. It gives you a laptop or a cycle, which doesn't.
You probably missed the last 20 seconds of your.
Of the chat. Yeah, I'm really sorry for the unstable connection. But we'll get to that when I go to the next slide. So let's go to the next slide, because policies do matter. Now, this is one policy, the child care benefits, that where families actually receive monetary benefits. They receive a particular amount on their bank account. But there is many more policies that we have in the Netherlands that single parents actually have to piece together in order to make ends meet. So this is an example of all the different types of financial streams that a single parent is entitled to, but you do have to apply for it and you do have to go after it. So if you are a single parent with 2 children that go to school, you are on unemployment benefits to top up your part-time work, and you live in a council flat, you have 12 income elements. You are engaged with 8 different institutions that arrange all these different income elements. You have to fill out 18 forms, and some of these forms you have to refill every year. and you receive about 80 payments a year in order to, make ends meet. This obviously is very complicated. Is a very complicated system for when we also know that the total level that you arrive at is actually too low to properly get by. There has been a very important commission in the Netherlands last year, the Commission for Social Minimum, that has determined what is a proper social minimum income to get by on, and they have deemed that our social minimum is short of about 100 to 500 euros a month, depending on your household composition. So if we move on to the next slide, please. This is another way of illustrating, and I'm sorry that this is in Dutch, but you really don't need to understand the words in this slide to get the idea. This in the middle, you see the single parent with children, and the circles around it are all the different elements that you could apply to in order to sustain and to get by. And this is, I think, very illustrative of what we just discussed. So on the right-hand corner, we have a number of national policies, national benefits that support for your rental income, that support for having children in the first place, that support for childcare, that support for your health insurance. Then you can also apply at municipality levels to not pay your local taxes. That's on the left-hand side. And then all the rest is all different amenities or offers that the municipality has put in place to support single parents. But as we have just heard, the totality of the system no longer makes sense. It has become incomprehensible for the parents. It has also become incomprehensible for the professionals who need to guide parents through this complicated system. And there is lots of uncertainty involved as well when applying for these benefits, because you can apply, but you need to submit a lot of forms. Every different entitlement has different requirements. So you can imagine that there's a large under-usage or non-take-up for many of these facilities. And that doesn't even get to the point whether this is what families actually need and whether this is what they want. So let's go on to the next slide, please. Now, what we see in the Netherlands is that the welfare state is actually reaching its limits. So I started the story with the comparison between being poor in a rich country like the Netherlands versus being poor in a different country, for example, Afghanistan, where I worked for a while. It's completely different. In the Netherlands, we have a very established welfare state. But what we see is that because this welfare state has been developed and built up over time, it has become so complicated that it has become a function of policy after policy. It's all being added on to a big structure that for the families no longer makes sense. They are no longer able to navigate this very well. In addition to this, we've had a particular scandal in the Netherlands which evolved around childcare benefits. I do not have time to go into all the details that you should actually know about this, but the thrust of this is that the government profiled certain households in the Netherlands for fraud based on benefits that they received for childcare. And as a result of that, they reclaimed the benefits that these families received entirely, often, sometimes over multiple years. So families would receive a reclaim of benefits received of amounts, totaling 5,000, 10,000, sometimes 30,000 euros at once. Obviously, these families didn't have that type of money, and we're getting into huge problems. This has significantly damaged the trust relationship between government and citizens in the Netherlands. It has very much damaged the people who were subject to this scandal, but it has had a much wider influence on the way that people perceive the government, trust the welfare state. Once you receive something, once you receive a financial compensation, can you actually keep it? Are you entitled to keep it? Or a couple of years down the line, do you have to repay it? So this has been very harmful for that trust relationship. We also see in the Netherlands that the government is at this moment the largest creditors. So this is also quite remarkable, and that in addition, low-income families have the highest probability of getting into debt, which is not a surprise if we say that our minimum income is too low. Obviously, then making ends meet becomes difficult, and there's a higher likelihood of actually getting into trouble and getting into debt. And the government, as the largest creditors, these are debts that are primary needs. This is for paying your rent, paying electricity, paying your health insurance. It's not that people went out shopping and couldn't afford it. Now, to close off, because this web of support has become so complex, any new problem that arises and a new policy is thought of, it just adds on to the already existing web of policies. And it interacts with what is already there. And this, again, makes it complicated for the professionals who have to execute these policies. And it adds to the difficulty of navigating the social welfare state in the Netherlands at the moment for families, single moms included. And as a result, there is quite a significant underusage of income support. People, and this is not just because of the complexity, it's also because of the trust that was damaged due to the childcare benefit scandal in particular. If we then go on to the next slide, please. Then to close off, I think one extra thought that I wanted to give to you is that I think there are different sources of stress when we talk about a developed welfare state that families are confronted with. So we all know about the theories of having little money results in financial worries, and this impacts your ability to take decisions, etc. But when you have a developed social welfare state, there is an additional level of stress, as we see it in the Netherlands. And this is what I call system stress. This is, the need, when you are in low income, you need to call on to the system of the social welfare state, but it also adds on stress if you are unable to navigate the welfare state due to its complexity. The uncertainty, when you apply for something that you are entitled to, but whether you will actually receive it. Once you receive the money, whether you can actually keep it or whether you will have to repay it. Maybe build up system debts with the government, an entirely different debt compared to when you take out a loan for consumption, for example. So I think the system itself as a stress factor is something important to be aware of. And I think this is also the key challenge that lies ahead of us for the Netherlands to redesign our social policies, because these social policies are no longer just a support for people. They also bring people into problems. They actually worsen their problems. And this is something that, of course, we should avoid at all times when talking about families with low income and all the problems that they already have to deal with on a day-to-day basis. Thank you very much.
Thank you so much, Anna. Beautiful presentation and revealing too. Thank you for all the information you gave us. It was really an eye-opener for me to see how many for how many parts the system is and how complex it is. I didn't realize that, but thank you for the information. And I'd like to ask Christine, is there any questions for Anna at this moment in the chat?
There are two questions, or a few. The first is from Arina. Arina, would you like to ask yourself or should I? Please go ahead.
Oh, dear Anna, thank you so much for your information. As a woman above 65 and living in a single household, I always ask also to super mom, how old are they? And I'm above 65. And so my question to you is, what would you see in the agreed conclusions of the Commission on the Status of Women 68 from your perspective?
Thank you very much for your question, Arina. And do you mean, is your question related specifically to the group, to the 65 plus, and
Yes.
what is important there?
Yes.
Yeah. I think there, you know, the issues are if you look at the Netherlands, it's, you know, I would say the question is similar. How do you ensure that your social policies are simple to navigate, and, you know, when you're talking about older age groups, you also do have to take into account the level of digital awareness, etc. And our societies are becoming increasingly complex. So that is a very important aspect in that. But the baseline is that you do want to make sure that the social policies that you have in place take care of people and do not bring people into problems, right? So if I'm talking about system debt, for example, this is something that holds for any age group, and it holds for any type of household. And I do think that this is equally important for 65 plus. Now, when we look at the specific policies in the Netherlands for this age group, we of course have the general pension that's there for everybody in the age of 68 and older, right? So that's a slight distinction. I think actually that particular policy, in a way, and this also maybe answers one of the other questions, is a good example of how we already have a universal income, but for people who are 68 and older. It is unconditional. Everybody receives it. There are issues with it for the households who receive just, you know, who are reliant only on this pension. For those household, it is low. It is not easy to get by, but I do think it is an example for other countries to think about how to take care of vulnerable groups when they grow older and when they can no longer actually earn their own income, right?
That's true. Because, you know, when COVID was there, I was thinking, and the high inflation in the Netherlands, I have to make money again when I become 75 plus.
Yeah. And so, yeah, because at some point you can no longer acquire more income through work, because, you know, you reach a certain age, and that makes you very vulnerable for certain external factors or shocks, like as you just described. I can actually see the questions in the chat. Shall I briefly go through them? So there is a question on taking in your experience from the World Bank for the Global South. What are interventions or practices that can be applied to the Dutch situation? So I think this is a very interesting question. And I do think that from the Global South, we could at this point learn more from unconditional cash transfers. So all the cash transfers that we have in the Netherlands have some sort of condition to it. Even think about our general benefits. The unemployment benefits, they have very strict requirements to it, and actually lots of incentives to try to get people back to work. They are very strict. You can also, you know, there's a heavy control or enforcement mechanism around it. So I think what we could learn from the Global South is that we know from various studies that unconditional cash transfers are very helpful, very productive. People invest their money in good things. They don't, you know, the assumption that people use their money for wasteful things is not right. Very often people invest in their children first thing. So I think that we can learn a lot from that, and be more trustful and positive about our views of humanity, if I may. Let me see the other question from Single Supermom. Would you see the benefits scandal as a technical policy problem, or as a problem of politicians choosing policy goals over serving the citizens of the Netherlands properly? I think it's both. So I think the technical policy problem was that people actually executed these orders, and that there were no mechanisms in place to identify that this was not okay, and that this was seriously not okay, and that there were that something was very wrong. But we all know that the reason why these policies were actually being implemented was a political choice. So it's the combination of both, because sometimes if you have a political choice to implement certain policies, then it is still up to the professionals who execute those policies to then raise alarm bells that things are going off track. And this is what didn't happen in the Netherlands, timely enough.